Have you ever noticed how the body sometimes tries to warn us, but we just brush it off? A sudden dizziness that comes out of nowhere, a different kind of tiredness, that shortness of breath we blame on age, or even swollen feet at the end of the day that we think are completely normal. The truth is, many of these small things can actually be silent warnings that your heart isn't doing well. And here's the scary part. Heart failure rarely begins with a dramatic heart attack or a sudden trip to the hospital. Most of the time, it starts quietly, with subtle signs that people ignore day after day. It's like your heart is whispering, "Please pay attention to me." But we get so used to blaming everything on aging, stress, or just a bad night's sleep that we miss the real message. And that's exactly why today, here on Longevity, we're going to have a different kind of talk. No complicated medical terms, no overwhelming statistics. Just a clear, honest, and human conversation about the 13 early warning signs of heart failure that could be happening in your daily life without you even noticing. And before you think, this has nothing to do with me, let me tell you something important. These signs can show up long before any diagnosis, and if recognized early, they can prevent serious complications, protect your quality of life, and in many cases, save your independence and your life. Imagine finding out that the forgetfulness you thought was just aging, or that restless sleep you've been struggling with, are actually your heart's way of asking for help. Now imagine having this awareness today and being able to act early instead of discovering it when it's already too late. That's why I want you to stay with me until the very end of this video, because I'm going to show you, one by one, the most common and most overlooked signals your heart might be sending. And simply knowing them could be a powerful step toward better health. If this message resonates with you, go ahead and subscribe to Longevity right now. Every week, we bring you essential insights that can truly change the way you take care of your health and your longevity. Now let's dive in. The very first sign might seem harmless, but it's often the tiny detail that reveals what's really happening inside your heart. When your heart is healthy, it usually beats calmly and steadily, around 60 to 100 beats per minute while at rest. But when it starts to weaken, it has to work overtime just to pump enough blood through your body, even when you're sitting still, doing nothing at all. That's when one of the earliest warning signs of heart failure can appear. Your heart suddenly racing for no clear reason. You might feel palpitations, a sudden thump-thump in your chest, or notice your heart pounding as if it's running a marathon while you're simply reading a book or watching TV. Many people blame it on coffee, stress, or a little anxiety. But the truth is, a racing heart at rest may actually be your body's silent cry for help. And over time, this constant extra effort only wears the heart out more and more. Here's a fact most people don't know, and it may surprise you. Research from the American Heart Association shows that people who consistently have a resting heart rate above 100 beats per minute face almost twice the risk of developing serious heart problems in the years ahead. So what seems like a small detail could actually be one of the biggest predictors of your future heart health. The good news is that you can start by simply tracking your resting heart rate. These days, it's easy to do with a smartwatch, a fingertip pulse oximeter, or even a smartphone app. And if you notice that your heart rate is consistently high, especially above 100, don't brush it off. Talk to your doctor. Remember, a racing heart for no reason isn't just an annoyance. It could be one of the very first signs that something important is happening inside your body. Have you ever walked into a room and completely forgotten why you were there? Or found yourself reading the same line in the newspaper over and over because you just couldn't focus? These moments may seem normal, and many people blame them on aging. But what few realize is that your memory and concentration can also reflect the health of your heart. When the heart can't pump blood efficiently, one of the first areas to suffer is the brain. That's because it depends on a steady flow of oxygen-rich blood to stay sharp.
When that supply is reduced, you may start experiencing memory lapses, mental fog, and difficulty staying focused.
A study published in the Journal of the American College of Cardiology found that even in the early stages of heart failure, signs of cognitive decline are common. And here's the surprising part. These symptoms can appear years before an official heart condition is diagnosed. You might notice, for example, that after climbing stairs, walking at a faster pace, or late in the day when your heart is more strained, your mind doesn't feel as sharp. Some people report struggling to find simple words during conversations, forgetting important appointments, or feeling less organized than before. Now, this doesn't mean every bit of forgetfulness is a sign of heart failure, but it is a reminder to pay attention to the bigger picture. If memory lapses or difficulty concentrating are becoming more frequent, especially when paired with fatigue or dizziness, it's worth bringing up with your doctor. Here's another interesting fact. Researchers have found that in people with heart failure, blood flow to the brain can be reduced by as much as 30% compared to healthy individuals. It's almost as if the brain is running on low power mode, with less fuel to process information. That's why it's helpful to notice when these lapses happen. Do they show up after physical activity, at certain times of the day, or along with other symptoms like palpitations or shortness of breath? Keeping a simple diary of these moments can help your doctor identify whether your heart might be behind the changes in your memory. Remember, taking care of your heart also means protecting your mind, because keeping your memory sharp and your thoughts clear is essential for maintaining independence and quality of life after 60. Have you ever noticed that by the end of the day your shoes feel tighter than they did in the morning, or that your socks leave deep marks on your ankles? This type of swelling, often dismissed as just a normal part of aging or standing too long, can actually be one of the earliest signs of heart failure. Here's why it happens. When the heart can't pump blood efficiently, blood begins to pool in the veins. That extra pressure pushes fluid out into the surrounding tissues, most commonly in the feet, ankles, and legs. Doctors call this peripheral edema. One important detail is that the swelling often gets worse as the day goes on. In the morning, your feet may look normal, but by evening they're visibly puffier. And unlike swelling caused by an injury, heart-related edema usually appears on both sides of the body at the same time. According to the National Heart, Lung, and Blood Institute, peripheral edema is one of the most common red flags that the heart is under strain. What's surprising is how many people live with this swelling for years without realizing it may be connected to their heart. Here's a simple home test. Press your thumb against your shin for a few seconds. If it leaves a dent that takes a while to fade, it could mean fluid is building up in your tissues. It's a small clue, but one that deserves serious attention. Another important point, swelling is often paired with sudden weight gain because the body is retaining excess fluid. That's why keeping track of both leg swelling and changes on the scale can help you catch the problem early. Your body is always sending signals, and when your feet, ankles, and legs start telling this story, it may be your heart quietly asking for help. Have you ever stood up from bed or a chair and felt the whole room spin for a few seconds? Or had the sudden sensation you were about to faint while doing something simple, like walking to the kitchen or climbing a few steps? Many times, these episodes are blamed on low blood pressure or just getting older. But in reality, they can be one of the early warning signs of heart failure. Here's why it happens. When the heart can't pump enough blood, circulation to the brain is compromised. So when you make quick movements like standing up suddenly, the brain doesn't receive blood fast enough, and it reacts with dizziness, blurred vision, or even fainting. Research published in the European Heart Journal shows that this reduced blood flow to the brain is strongly linked to dizziness, fainting spells, and loss of balance in people with heart failure. And it's not just uncomfortable. These episodes greatly increase the risk of falls, fractures, and hospitalizations in older adults. Take the example of Mrs. Helena, a 72-year-old woman. She used to feel a little dizzy every time she stood up from her chair. She thought it was just age, until one day while walking to the kitchen, the dizziness was so strong that she fell and broke her wrist.
Only then did she learn that her heart was under strain, and those little episodes were actually silent warnings. That's why it's so important not to ignore them. If this has happened to you, start noticing when the dizziness occurs. Is it after standing up quickly, after walking a short distance, or even during everyday activities? These details can help your doctor uncover the real cause.
And remember, whenever you feel dizzy, sit down right away, breathe slowly, and wait until it passes. But the most important step is to seek medical advice, because what may seem like a small inconvenience could actually be your body showing that your heart needs attention. Do you often wake up several times during the night just to go to the bathroom? Many people think this is simply part of aging, or maybe from drinking too much water before bed. But this symptom, called nocturia, can actually be one of the early signs of heart failure. Here's what happens. During the day, when you're standing or sitting, extra fluid tends to build up in your legs and ankles. When you lie down at night, that fluid returns to your circulation and makes your kidneys work harder, producing more urine. The result? Multiple trips to the bathroom throughout the night. According to experts at the Cleveland Clinic, nocturia can appear as one of the very first signs that the heart is under stress, sometimes even before more obvious symptoms show up. And the problem isn't just losing sleep. This constant cycle of waking up drains your energy the next day, weakens your immune system, and puts even more strain on your heart. Here's something to notice. Many patients report getting up 3 or more times at night. That pattern should never be ignored, especially if it's paired with leg swelling, sudden weight gain, or shortness of breath. A simple step that may help is elevating your legs during the day for a few minutes to reduce fluid buildup. But if the problem continues, it's important to talk with your doctor, because restless nights could be a direct reflection of a heart that's asking for help. Sleep should be a time of rest and recovery. If your nights are being interrupted again and again by bathroom trips, your body may be sending you a quiet warning, and it's worth listening. Have you noticed that your hands and feet stay cold even when the room feels warm? Or that compared to others around you, you seem to be the only one feeling that chill in your extremities? This symptom is often blamed on aging or poor circulation, but it can actually be one of the earliest signs of heart failure, and science backs this up. What the research shows. A study published in the American Journal of Cardiology found that patients in the early stages of heart failure often show a significant reduction in peripheral blood flow, meaning less blood reaches the hands, feet, and skin. This happens because when the heart weakens, it has to prioritize pumping blood to the most vital organs, like the brain, lungs, and kidneys. As a result, less essential areas, such as the hands and feet, receive less circulation. Why this matters? That reduced flow explains the constant cold sensation and, in some cases, tingling or numbness in the extremities. This research proves this isn't just in your head, it's a measurable change directly linked to early heart dysfunction. One practical consequence is that even your pulse in the wrists or ankles may feel weaker since blood isn't reaching those areas as strongly. Some people notice it during simple tasks like holding a glass of water, only to realize that it's actually their body sending a warning. What to look out for? If your hands and feet are often cold, even in warm settings, pay close attention to that contrast. A weak pulse in the wrists or ankles can also be a sign that blood flow is reduced. And if cold extremities happen together with fatigue, swelling, or shortness of breath, that's an even stronger signal your heart may be under strain. Remember, your body sends quiet signals long before bigger problems show up. Cold hands and feet may seem minor, but they can be an important early clue that your heart needs attention. Have you ever found yourself out of breath just from climbing a few steps? Or noticed that simple tasks like carrying groceries or walking to the mailbox suddenly feel much harder than they used to? This symptom, known as shortness of breath with mild exertion, is one of the most common early signs of heart failure. When the heart can't pump strongly enough, fluid begins to back up into the lungs. This makes it harder for oxygen to move through your body, so even small activities can feel like running a marathon. It's not about being out of shape, it's your body sending a clear warning signal. A study published in the Journal of the American Medical Association, JAMA, found that shortness of breath during light activity can appear years before a formal diagnosis of heart failure. In other words, the fatigue you may be blaming on age or lack of fitness could actually be your heart asking for help.
Many people notice this in very specific situations. Climbing just a few steps, walking while having a conversation, or even doing everyday chores like gardening or tidying up the house. It's important to pay attention to patterns. If you find yourself short of breath doing things that once felt easy, write down when it happens, how long it takes to recover, and whether it comes with palpitations or chest discomfort. These small details can give your doctor valuable insight. A helpful tip is to learn to respect your pace. Take breaks, don't push through exhaustion, and give your body time to recover. But remember, this does not replace medical evaluation. What may feel like just normal tiredness could actually be one of the most important early signs of heart failure. Many people go to bed expecting a restful night, but instead find themselves struggling to breathe. Lying flat suddenly feels uncomfortable, and the only way to get some rest is by stacking several pillows or even sleeping sitting up in a chair. This symptom has a medical name, orthopnea. It happens because when you lie down, the fluid that built up in your legs during the day shifts back into your circulation and puts extra pressure on the lungs. If the heart is already weak, it can't handle the overload, and the result is shortness of breath at night. Take the example of Mr. Antonio, a 68-year-old man. He used to say he couldn't sleep without 3 pillows propped up behind him. At first, he thought it was just a habit. But over time, he noticed that without them, he would wake up in the middle of the night gasping for air. When he finally sought medical help, he discovered it wasn't about bad sleeping position at all. It was his heart sending a silent warning. Studies published in the New England Journal of Medicine show that orthopnea is one of the strongest predictors of heart failure progression, often appearing well before more serious symptoms. That's why it's so important to ask yourself, can you sleep comfortably lying flat? Do you need 2 or 3 pillows just to breathe better? Have you ever found yourself sleeping upright to avoid that suffocating feeling? These details matter. They may seem small, but they give doctors valuable clues about whether your heart is under strain. Remember, bedtime should be a time for rest and recovery. If lying down makes you feel short of breath, it's your body sending a clear message, and it's time to listen. Have you ever stepped on the scale and noticed you gained 4 to 6 pounds overnight, even though you didn't change your eating habits? This type of rapid weight gain, not linked to food, can be an early sign of heart failure. Here's why. When the heart can't pump blood effectively, the kidneys start to hold on to extra salt and fluids. That fluid buildup doesn't just push the number on the scale higher. It can also cause swelling in your legs, your abdomen, and even make it harder to breathe. According to the American Heart Association, gaining more than 2 to 3 pounds in a single day or 5 pounds in a week is a strong warning sign that your heart may be under strain.
What's tricky is that many people think they're just bloated or putting on weight with age, when in fact it's their bodies sending an urgent signal. Take the example of Mrs. Maria, a 70-year-old woman. She once gained almost 9 pounds in just 3 days, even though her diet hadn't changed at all. At first, she thought it was normal water retention. But soon her legs began to swell, and she was out of breath just climbing a few steps. That's when she discovered her sudden weight gain was tied to her heart. One practical step anyone can take is to weigh yourself every day at the same time. This simple habit can help you spot sudden changes that might otherwise go unnoticed. Writing down your weight in a small notebook or using a smartphone app can be an important ally for your health. Remember, the scale isn't just about diet or appearance. It can be an early warning tool to protect your heart. Have you ever felt full after just a few bites of food, or noticed that you've lost interest in eating, even at meals you used to enjoy? This feeling of bloating or loss of appetite can be one of the early signs of heart failure. When the heart begins to weaken, blood doesn't circulate properly, and fluid can build up in the abdomen, a condition known as ascites.
This fluid puts pressure on the stomach and liver, leading to abdominal discomfort, swelling, and the sensation of being full even after eating very little. According to the National Heart, Lung, and Blood Institute, ascites and appetite loss are common in patients with heart failure, even in the early stages. This symptom is especially concerning because it doesn't just affect comfort, it also affects nutrition. When you eat less, your body receives fewer nutrients and less energy, which can lead to muscle loss and overall weakness. It's important to pay attention if your abdomen seems more swollen at the end of the day, if your clothes feel tighter around the waist, or if you often feel abdominal discomfort. Keeping a simple diary of when these symptoms occur can help your doctor determine whether they may be related to your heart. Remember, food is essential for maintaining strength and vitality. If your body begins to reject food, it may be a sign that something more serious is happening inside, and your heart could be at the center of it. Have you ever gone to bed only to be kept awake by a dry, nagging cough? Or noticed a wheezing sound in your chest when you lie down, almost like asthma, but nothing seems to make it go away? This symptom can be one of the early signs of heart failure. When the heart can't pump blood strongly enough, fluid begins to build up in the lungs. That extra fluid irritates the airways, causing a persistent cough and in some cases wheezing, especially at night or when lying flat. Research published in the American Journal of Respiratory and Critical Care Medicine shows that this type of nighttime cough is directly linked to fluid buildup in the lungs in patients with heart failure. It's different from the cough caused by colds, flu, or allergies because it doesn't improve with regular syrups, inhalers, or common medications. One key detail: this cough is usually dry, without mucus, and it tends to worsen when you lie flat, since that position makes fluid shift more easily toward the lungs. Many people say they only find relief by sleeping with their head elevated. So if you've had frequent nighttime coughing that doesn't respond to standard treatments, it's important to notice the pattern. Don't ignore it. It may be your heart showing signs of strain. Nighttime should be for rest and recovery. If coughing or wheezing keeps stealing your peace, it may be time to listen to what your body is trying to say. Have you ever felt short of breath just from bending down to tie your shoes or pick something up from the floor? This symptom even has a name: bendopnea. Here's why it happens. When you bend forward, blood shifts toward your chest. In a healthy heart, that's no problem. But when the heart is weakened, this extra pressure makes it harder for blood to move through the lungs, leading to a quick, uncomfortable feeling of breathlessness. Research published in the Journal of the American College of Cardiology found that many patients with heart failure experience bendopnea in less than 30 seconds after leaning forward. And what's surprising is how often it shows up in simple everyday situations: tying your shoes, gardening,
or reaching into a low cabinet. Because it seems so ordinary, many people dismiss it as being out of shape or just overexerting themselves. But in reality, it can be an early warning sign that the heart is under strain. If you've noticed shortness of breath when bending forward, pay attention to how long it takes for your breathing to return to normal and which activities trigger it. These details can give your doctor valuable clues. Remember, even the simplest signals, like feeling breathless during ordinary tasks, can be your body's way of asking for attention. Don't ignore them. Do you ever feel tired all the time, even after a full night's sleep? Or notice that simple tasks, like making the bed, taking a shower, or carrying light grocery bags, now feel much harder than they used to? This persistent fatigue that doesn't improve with rest is one of the most common signs of heart failure. When the heart can't pump enough oxygen-rich blood to your muscles and organs, your whole body begins to feel the effects. Energy drops, physical endurance decreases, and even everyday activities can leave you exhausted. Research published in the Journal of Circulation confirms that chronic fatigue and reduced exercise tolerance are among the earliest and most frequent symptoms of heart failure. And it's different from normal tiredness, which usually gets better after rest. Here, the exhaustion lingers, even after a good night's sleep or a day of taking it easy. One important detail: this kind of fatigue often develops gradually, so it's easy to miss at first. Over time, you may notice that you can't walk as far as you used to, that you need more breaks during the day, or that you've lost interest in activities you once enjoyed.
Ignoring this symptom can slowly reduce your quality of life. That's why it's essential to recognize when fatigue stops being normal and starts interfering with your daily routines. Remember, keeping your strength and energy is key to maintaining independence and well-being. If constant fatigue has become part of your daily life, it could be your heart asking for attention. Now that you've learned the 13 early signs of heart failure, you may have realized that many of them seem like small, everyday details: a little dizziness, swelling in the feet, or unusual tiredness. But as we've seen, these are actually silent warnings from your body, asking for care and attention. The good news is that when these signs are recognized early, they can make all the difference. With medical guidance, lifestyle changes, and awareness of your symptoms, you can protect your heart and keep living with quality, energy, and independence. Your heart has carried you through your entire life, through every emotion, every achievement, and every meaningful moment. It deserves to be heard and cared for. So if this video resonated with you, share it with your friends and family. You might help someone recognize an important sign in time. And don't forget to subscribe to Longevity. Every week, we bring you essential information to help you live longer, healthier, and stronger after 60. Your heart speaks in silence. The choice to listen could change your life.